Hi, my name is Amy Slatter, and today I'm here to talk to you about my placement experience and the 40 hours that I completed for the course of Advanced Clinical Exercise Science. This presentation offers an insight to my placement experience involving topics of the background of the business that I completed placement for, the population that I worked with, the tasks that I completed and observed, my contribution to the workplace, what I learned and the skills developed, the value of my experience and how it affected my professional pathway, as well as a project completed within this time. So I completed placement at Mercy Day Therapy Day Centre in Rockhampton, which runs in conjunction with Mercy Aged Care. This is where older adults are medically transferred if they require the services that are offered here. I was mostly involved in the classes, which included balance and mobility, self-help courses around the topics of falls prevention, arthritis and diabetes, lower limb strengthening classes, clinical Pilates and aquatic yoga. The staff there consisted of 2 physiotherapists who ran group classes as well as seeing individual clients, 1 occupational therapist who autonomously completed home visits, 2 receptionists who greeted clients, assisted with classes and setting up and packing up, picked up any clients who couldn't get to the centre on their own, as well as making coffees for the clients and cleaning. And lastly, 1 older adult volunteer was there who helped set up and pack up for the classes, made coffees, assisted with cleaning, etc. So the population that I worked with had included conditions and injuries such as lymphedema, sensory motor neuropathy, bronchiectasis, joint problems, cardiac issues, knee and hip replacements, sciatica, osteopenia, osteoarthritis, osteoporosis, Parkinson's disease, rheumatoid arthritis, vertigo, balance issues, and stroke. So, tasks within the Mercy Day Therapy Centre involved mostly observing as the professionals treated the clients. Through observation of the classes, a couple of times I got to direct warm-ups if the physiotherapist was busy with individual clients. In all of the classes, I got to know each individual through walking around and talking to them. I also assisted in moving the clients, retrieving any walking aids, adjusting equipment, and answering any questions that the clients would ask. I contributed through being an extra assistant within these classes and helped any clients if they needed it. My knowledge of different exercises and what muscles they worked were also a contribution if clients asked. Also, if they needed help completing the exercises, my knowledge assisted in directing the correct technique. Throughout this experience, I learnt about diverse conditions and injuries through asking the professionals and the clients themselves. For example, I learnt that as you get older, or past the age of 29 years, the supraspinatus actually becomes weaker, causing inflammation and potential tearing. I also learnt about these cool outdoor fitness parks, which provide essential and free exercise equipment to improve strength and balance, which I think is a great idea. The skills that I developed from this experience involve the improvement of my exercise prescription and explaining the exercises to clients. This was also improved through taking the couple of warm-ups. I also developed client interaction and my knowledge around the diverse conditions presented during this experience, along with my knowledge in utilizing the Pilates machines, as you don't come across them at a general population gym. This experience presented a lot of benefits towards my learning and determining what path I'd like to head down after graduation. I learned different ways of improving strength and balance within this delicate population. My knowledge of the human body was also put to the test, as well as my exercise prescription skills. It also gave me an opportunity to learn about different conditions and how it affects individuals and when they exercise, along with hearing a lot of personal stories and advice to take on board that can relate to my life and my loved ones' lives. Overall, this was a great experience and gave me the confidence around working with older adults, as it is the career path that I would like to head down upon graduation. So I chose this placement as I would like to work with older adults upon graduating. It is what I enjoy doing. I want to assist in improving their quality of life through exercises and activities that strengthen their bodies, avoid falls that may injure their physical and them physically and mentally, as well as expanding their cognitive function through the social engagement offered when they exercise. I believe that falls prevention is a very important topic when it comes to this population, and so do the Mercy Day Therapy Centre staff. Therefore, I completed my project based on this topic. So, falls actually affect 30% of people over the age of 65 years within the community, and this increases with age. In 2010 to 2011, 450,000 people over the age of 65 years were admitted to hospital due to a fall. Also, aging causes impairment of executive functions of the brain involved in attention and movement, which disturbs higher levels of balance and gait control. And with this paired with musculoskeletal deterioration, this can increase the risk of falling. So, while researching this topic, I found a few studies involving resistance training and activity and Pilates exercise and how they affect falls prevention. So I found that 12 weeks of functional circuit training actually improves physical frailty, strength, balance, and gait speed. It was also found through comparing 6 months of resistance training, agility training, and stretching programs that resistance and agility training actually lowered the falls risk significantly compared to the stretching program. It was also found that 8 weeks of Pilates exercise can improve significantly mobility, postural stability, balance, and decrease the risk of falling. On the other end of the spectrum, it was also found that physical inactivity can actually have a large effect on the health through 1 month of detraining actually reversing and declining the functions after a resistance and aerobic training program. Also, the timed up and go test, this was based around the results of this test, and it has been found and deemed a very accurate measure of measuring dynamic balance within general and disease-based populations. So this course was split up where once a week for 6 weeks an educational presentation was presented, and then moved on to an exercise class to improve the balance and mobility of persons over the age of 65. So the timed up and go test was completed before and after the course, which ran for 6 weeks to find the benefits of this course. So the self-help course actually educated them on the background of falls prevention, the statistics, consequences involved in falling, the cost to the healthcare system, risk factors, risks around the home, such as the toilet, the bathroom, any floors, etc. The strategies around improving falls prevention, like strength training and balance. Examples of balance exercises, the benefits of resistance training, walking aids, hip protectors, and it was also talked about sight and vestibular function, nutrition management, and what to do if a fall occurs. So the equipment utilised within the exercise program included Pilates machines such as the DMA, trapeze table, and clinical reformers, where they could complete seated row, lying front raises, lateral row, leg strengthening through knee flexion and extension, and this was great because it was soft on joints, and a lot of it was involved involve them lying down, so that was very good for them. Sorry. There's also the stairs, which consisted of 4 steps with 2 rails on each side, where they could complete lunges, lateral, forwards and backwards leg swings, mini squats and calf raises, which was great because it gave them support with the 2 rails on the side while strengthening their lower limbs. There was also parallel bars where they had 2 bars beside them and a different walking surface that we could manipulate. We could put soft walking surface, hard walking surface, etc. Where they could walk forwards 3 meters, backwards, sideways. They could cross over legs, etc. This give them practice in walking as it considered the outside environment and different uneven surfaces, and it was good because it provided support with the rails to hold on to. There's also a rehab balance beam, hexagon floor tiles and fitball, which catered for balance, and deluxe 1 pedal exerciser and ankle weights, which catered for leg strengthening. So, searching the literature, I used the databases of ESSC13005 and PubMed, where I used the terms falls prevention, old adults, and the up and go test. I also found extra resources upon reading what I found through searching these terms. I refined the search to the recent 11 years for more recent articles, and also refined it to peer-reviewed and full-text options. So the timed up and go test consisted of a chair 52 centimeters above the ground. The clients would walk 3 meters around the cone and back and sit back in the chair. It was timed from when the client got off the chair to when they sat back down. 3 attempts were taken and 1 average score was written down. Walking aids were optional, and previous outcomes found randomly within their filing system found recent results, and it found that in 8 clients, all improved in their times between the 6 weeks, and the improvement was an average of 1.46 seconds. They shaved off the time of their before and after test, so that was great. So each session consisted of a warm-up, which was demonstrated by the physiotherapist. This involved seated exercises to stretch using half-cut up pool noodles, along with muscular and joint warm-up using dumbbells, and breathing exercises through Tai Chi movements, encouraging breathing. Although the setting was autonomous, the physio gave feedback where required and kept an eye on each individual and asked them questions about their health, such as recent falls, etc. There were also pictures on the wall around the equipment to demonstrate, so that the physio didn't have to explain it all the time. So it has been found that a mix of resistance training and Pilates saw a positive influence on strength, balance, functional performance, and falls in older adults. This mix of resistance training and Pilates was seen within this program, which is also found to improve dynamic balance. It has also been found that specificity of exercise affects results. For example, cardiovascular fitness has not demonstrated benefits like resistance training and falls prevention. Mentioned that great effects of preventing falls are found in challenging exercises and do not include a walking program. Lastly, consistency has been found to be the key, as 1 month of detraining can reverse and decline function. So functions of the body deteriorates as it ages, and balance is affected, causing a high risk of falling. This exercise program combines resistance training, balance exercises, and Pilates exercises, which has been found to improve the risk of falls through a balance assessment of the timed up and go test. So this program educates, it demonstrates simplicity through demonstrating exercises on the wall. They have a physio at hand, which gives an opportunity for suggestions of home-based exercises. It also prepares the clients for unexpected environmental factors, such as using the stairs and uneven ground. This program has also been shown to improve balance and mobility of older adults. Thank you for listening.